What is mucormycosis? Mucormycosis, sometimes called zygomycosis or commonly black fungus, is a serious but rare fungal infection caused by a group of molds called Mucormycetes. These fungi live throughout the environment, particularly in soil and in decaying organic matters such as leaves, compost piles, or rotten wood. So, what are the chances of getting mucormycosis? People get mucormycosis through contact with fungal spores in the environment. For example, the lungs or sinus forms of the infection can occur after someone inhales the spores from the air. A skin infection can occur after the fungus enters the skin through a scrape, burn, or other type of skin injury. Now, is the mucormycosis contagious? Which is definitely no. Mucormycosis can't spread between people or from people to animals. So, who gets mucormycosis? Mucormycosis is rare, but it's more common among people who have health problems or take medicines that lower the risk of body's ability to fight germs and sickness. Certain group of people that are more likely to get mucormycosis includes people with diabetes, especially with diabetic ketoacidosis, people with cancer, people with organ transplant, stem cell transplant, renal diseases, long-term corticosteroid use, injection drug use, people with too much iron in the body, iron overload, or a condition called hemochromatosis, people with skin injury due to surgery, burns, or wounds, prematurity and low birth weight for neonatal gastrointestinal mucormycosis. The process of phagocytosis is somehow slowed or stopped during the effect of mucormycosis. There are several manifestations of the mucormycosis. Rhinocerebral, sinus and brain mucormycosis is an infection in the sinuses that can spread to the brain. This form of mucormycosis is most common in people with uncontrolled diabetes and in people who have had a kidney transplant. The symptoms are one-sided facial swelling, headache, nasal or sinus congestion, black lesions on nasal bridge or upper inside of the mouth that quickly becomes more severe, and there is always high fever. Another manifestation is pulmonary or lung mucormycosis. It is the most common type of mucormycosis in people with cancer and in people who have had an organ transplant or a stem cell transplant. The symptoms are fever, cough with chest congestion, with severe chest pain and shortness of breath. Gastrointestinal mucormycosis is more common among young children than adults, especially premature and low birth weight infants who are less than 1 month of age, who had antibiotics, surgery, or medications that lowers the body's ability to fight germs and sicknesses. The symptoms are abdominal pain, nausea accompanied with vomiting, and even gastrointestinal bleeding. Cutaneous or skin mucormycosis occurs after the fungi enter the body through a break in the skin, for example after surgery, after a burn, or other type of skin trauma. This is the most common form of mucormycosis among people who do not have weakened immune system. So, how can one reduce the risk of mucormycosis? It's difficult to avoid breathing in fungal spores because the fungi that cause mucormycosis are common in the environment. There are no vaccines to prevent mucormycosis. For people who have weakened immune systems, there may be some ways to lower the chances of developing mucormycosis. Protect yourself from the environment. It's important to note that although these actions are recommended, they haven't been proven to be effective against safety of mucormycosis. Try to avoid areas with a lot of dust like construction or excavation sites. If you can't avoid these areas, wear an N95 mask. Avoid direct contact with water-damaged buildings and flood water after hurricanes and natural disaster. Avoid activities that involve close contacts to soil or dust, such as yard work or gardening. If this isn't possible, wear shoes, long pants, and a long-sleeved shirt when doing outdoor activities such as gardening, yard work, or visiting wooden areas. Wear gloves when handling materials such as soil, moss, or manure. To reduce the chances of developing a skin infection, clean skin injuries well with soap and water, especially if they have been exposed to soil or dust. Antifungal medication. If you are at high risk of developing mucormycosis, for example, you have had an organ transplant or a recent stem cell transplant, your healthcare provider may prescribe medication to prevent mucormycosis or similar types of other mold infections. Doctors and scientists are still learning about which transplant patients are at higher risk and how to best prevent fungal infections. How is mucormycosis diagnosed? Healthcare providers consider your medical history, symptoms, physical examinations, and laboratory tests when diagnosing mucormycosis. Healthcare providers who suspect that you have mucormycosis in your lungs or sinuses might collect a sample of fluid from your respiratory system to send to a laboratory. Your healthcare provider may perform a tissue biopsy in which a small sample of affected tissue is analyzed in a laboratory for evidence of mucormycosis, which would be examined under a microscope or in a fungal culture. You may also need imaging tests such as a CT scan or an MRI scan of your lungs, sinuses, or other parts of the body depending on the location of the suspected infection.